so much for joining in again. Just with a quick show of hands, let me know if you can see my screen. That's always a concern of mine with some of the issues that we've had. Excellent. Thank you very much. So we have quite an agenda today. Of course, it is the last week of open enrollment, the death rattle, if you will. And, you know, things are coming in pretty quickly. You know, the cutoff date is Sunday the 15th for on exchange, and unfortunately, or maybe fortunately, the carriers have kind of, for off exchange, decided for February to mimic the 2/15 cutoff date as well for a 3/1 effective date. So if you have on exchange clients, 2/15 is the last day to enroll them. And otherwise, they would have to have a special election period or a qualifying event to get them into the special election period. For off exchange, for a 3/1 effective date, the carriers that are extending their enrollment towards the end of the month would be UPMC. They're extending until the very last day, 2/28, and Blue Cross of Northeastern PA is extending as they have every month till the 25th. Other than that, Sunday is the last day. Your health plan options department will be working on Sunday. We're going to be in here from 10 to 2. No one's real happy about that, but we understand that you know, we need to be here to support our agent partners who have supported us and you know, pay our salaries. So we will be here if anything comes up. We'll be processing off-marketplace submissions and here to answer your questions. So I wanted to now get into the next bullet point, and that's special election periods. And on our website, if it's going to come up, let's hope it will come up. There it is. On our health plan options key, you're going to see the carriers and, of course, the carriers that have special election forms. And I wanted to just kind of show you a special election form. So you, oh, well, isn't that special? So, well, I can't show you. For some reason, our site must be down. But you know, some of the qualifying events is if your client loses employer-sponsored coverage, if they no longer are eligible for Medicaid, if they're aging off of CHIP, if they move to a different location. So there are a number of if they get married, if they have children. So some of those are qualifying events, and those are the ones that you're going to start to look for after Sunday. There's a lot of opportunities to sell outside of the open enrollment period, and I would hope that if anything is questionable, that you run it by us, and if we feel that it would, you know, go through as a qualifying event, we'd absolutely be happy to process those applications and those special election period qualifications for you, applications. So we also, in last week's healthcare reform newsletter, talked about Highmark and, you know, the other carriers. The FFM business, some of the NPN numbers, of course, fell off somehow, as they did last year. So we're going to try to keep a really close eye on that. But the real concern of mine is that for both Northeastern PA, Blue Cross, and Highmark Central and Highmark Western, they have come out with the broker authorization forms to claim that those cases, but they both require that that form is submitted within 90 days of the effective date. The way the commissions are paying, I'm not sure that we're going to know within 90 days. Now, I'm hoping that they make some exceptions, but if at all possible, if you can work with your case manager, make sure that all of your FFM business is accounted for, we can help you with that, because it's going to be really key to try to figure out if you're hooked into those cases, and if you're not, you're going to immediately need to get us that authorization form so that all of your hard work is not wasted. So just be mindful of that. I did include this again in this week's newsletter just because I thought it was important enough to have it in there more than once. So if you have any questions about that, then please refer to the healthcare reform newsletter that's coming out later today. Also in the newsletter, I'm including a lot of things about the Anthem breach. Every carrier has come out with information and details, every Blues carrier, I should say, on how they're interpreting this and how they're working towards making sure that none of their members, past or present, have been affected by this data breach. You know, I guess from a safety perspective, you know, once they evaluate if your clients or yourselves, if you're insured with Highmark or any of the Blues, has been affected, you will get notification. But just be mindful, keep watching those credit reports, and make sure that your information is not breached. If it is, please let us know, and we'll get you in touch with the right people. The next bullet point is about the CHIP and the buy-ins. Many of you have already started calling about this. Somehow HHS has decided that anyone that is on a CHIP program that had a buy-in, you know, they didn't get it for free, they were either the low cost or at cost. HHS has decided that the buy-in CHIP people did not meet minimum essential coverage. I'm not sure how that's even possible, but clearly it's fighting City Hall at its worst, and these people, these kids, will be terminated from coverage. The notes are starting to come out now. You can help them. About 3,600 children in Pennsylvania are affected by this, so you can certainly help them by either adding them on or off exchange to their parents' plan, or writing them on a child-only plan. So if you do have a member that is affected, then let us know and we'll help you with that. So last week's newsletter and also on my webinar, I talked about Western Highmark Blue Cross Blue Shield and UPMC. Highmark was giving a courtesy pass for the first claim that came in that was for a UPMC provider. Highmark was going to give a courtesy pass, basically treating that as in-network, and then making you know, strides to get those clients either in a different provider network so that they can use the Highmark providers and would not then have to have any claims faced as out-of-network. Evidently, there's something in the language that made them recall this message. That's going to be in the newsletter. It just came in late yesterday, so more details will follow on that. But at this point, that message and that courtesy pass has been uncourteously recalled. So just be mindful of that for those that are affected. Healthy PA, many of you have also read this. This is also going to be in my newsletter. Healthy PA was Governor Corbett's fiscally responsible expansion of Medicaid. What it did was, for those that were newly eligible for Medicaid, those under 133% of the FPL, they would be able to enroll in Healthy PA. Healthy PA mimicked the same silver or metal level plans, I should say, that are available in the private market. Governor Wolf decided that he was not going to go with Healthy PA. He wrote a letter to HHS asking to essentially dismantle the Healthy PA product, and they are going to be transitioning into the traditional Medicaid programs. This transition is set for June. So anyone that's currently enrolled in Healthy PA will be getting notified that they would be transitioning to the traditional Medicaid. And if any of you have gone out to the PA Compass site, the Healthy PA and everything about it has been pulled. So again, now as we're closing open enrollment for 3/1 effective dates, if you have anybody that would be Medicaid eligible, they're going to be going to the traditional Medicaid programs. Also, one of my agent partners had a situation where they had an FFM that was insured and they passed away. So not ever having experienced this on exchange, she did a little homework and found out that how to handle this on the exchange. If a family member if the primary or a family member passes, then a family member can call into the marketplace and report the death. It would have to be somebody who is already on the application and 18 years or older, so preferably a spouse or an adult child. Even an agent that their authorization has stuck with the system is not authorized to do that. If there is no such family member on the application, then they would have to submit proof of the death for the deceased, insured, either a death cert, obituary, proof of estate, anything that would include the consumer's name, date of birth, social, and app ID, and it can be mailed right into the London, Kentucky address for the exchange. So that's some interesting information that I wanted to pass on to you in case you're ever faced with that situation. Again, I'm going to encourage all of you to use our FFM upload link. This is our first defense at recognizing your case and starting to follow not only in status, but making sure you're hooked into the case and starting to watch and wait for those commissions. So if you've waited till the end of the season to do that, that's perfectly fine. Again, I would encourage you to do that. That's going to be in my newsletter as well, and of course it's always on our site under the Health Plan Options tab and under FFM forms and links. So please take some time to do that. It's an easy form to fill out. We only need your name, your client's name, Social Security, date of birth, the effective date, and the carrier. So you're going, and there again is also the opportunity to upload those applications that you have. So we have record of that. It's easy to use, and again, I encourage you to use that if you've not done so already. So that's it. That's what I have for the agenda today. I'd be remiss if I didn't thank you all as we wind down for your partnership in the business that you've submitted through URL. We appreciate it very much, and thank you for that business. We're going to now open it up for the open forum. Let's see if we have any questions. I know last year we didn't. All right, so we have a few. Kim says, can you cover the chip buy-in information again? Absolutely. The kids that are under 19 that either on exchange or off exchange had bought into the chip either with a low cost or with the at-cost chip. The HHS decided that that coverage did not meet minimum essential coverage. So it is being terminated because it doesn't meet the standards somehow. Again, that's a big question mark. But these kids are receiving notification that they are no longer going to be eligible to be covered on chip, and they have to transition to either on marketplace or off marketplace coverage, not chip. So that's all the information we know at this point. We did get a couple calls yesterday about it. Thankfully, they were both off exchange. So it was just a matter of doing an add-on form, went pretty smoothly. For on exchange, I'd be interested to see if anyone experiences that and tries to add the child to their parent's plan and see how that process works. So if one of your clients is affected by this and it is on exchange, please share that experience with me. Joe says, can you clarify, did you say Healthy PA has been pulled from the Compass website? I did. And he said he just referred someone to the site this morning as they didn't qualify for a premium tax credit. Yeah, Joe, it's totally off the website. There is an area where it looks like you can make application, but it would be for the traditional Medicaid. And there's also a PDF on that. So that's really the only choice at this point. And again, June seems to be the deadline for that transition. So that's it. That looks like all of the questions that we have coming in. Tracy says, as I said that, another one comes in. Tracy says she's added children onto the parent's plan. When you get the Medicaid chip questions, just check off the box as meaning yes, and it will automatically add the child. Oh, probably the box that says, were you recently, did you recently become ineligible for Medicaid or CHIP? So that's probably the box that Tracy's referring to. All right, so if there are any last-minute questions, go ahead and type those in. Again, I'll leave you with the fact that we'll be here helping you on Sunday from 10 to 2. And, you know, again, thank you so much for your partnership through this challenging enrollment period and your partnership and your business. We appreciate it. We'll be here next week, February 19th, to at least do a wrap-up. And again, we'll continue to offer these as long as we have information to share and as long as you have questions that I feel can help other agent partners. Because, again, we sink or swim together in this. So, again, thank you very much, and I wish you all a healthy and happy week and long weekend. Enjoy yourself. Bye-bye.